it's Nina, the baby chick, and welcome to this week's video of Chick Chat. First, I want to say happy Memorial Day weekend to all of you out there. I hope you have some fun plans to celebrate this long weekend. And I'm wearing my red, white, and blue to support all of our troops. And thank you to all of our veterans for what you do. Next thing, I want to also keep you guys posted that we have some great giveaways coming up in June in honor of Father's Day. So definitely be on the lookout on our social media pages and on our blog. Now, like I had said on our last video, I'm going to be answering one of your questions each week in our Chick Chat video. And this week, I'm going to be answering a question from Chen in Houston, Texas. Her question was, Nina, now that I'm expecting, what are the questions that I need to be asking my OB? This is a great question. So I've come up with a list of my top 10 questions that you should be asking your OB once you find out you're pregnant. So here we go. Question number 1. Are you going to be in town for my due date? This is definitely important. You want to make sure that your doctor that you've built a relationship with is going to be in town. And if not, that's okay. You want to also understand, is this a solo practice or is this a group practice? If it is a group practice, you might want to try and see if you can meet the other doctors, so then you're a little bit more comfortable of who's going to be there potentially for the birth of your baby. So question 2, what is your philosophy on birth? I think this is going to be a very telling answer when they give this to you, because you're going to understand, is this a doctor that's rushing you through it, if they're going to be really patient and really support you for what you want for your birth experience, or if it's their way or the highway. So definitely a great question to ask. Question 3, what is your cesarean birth rate and what is the practice's cesarean birth rate? Here in the United States, 33% of deliveries are done through cesarean rates, or through cesarean sections. So you want to understand what your doctors and the hospitals and your practice's cesarean rate is. Now, question 4. What is your episiotomy rate and what is your position on them? Now, an episiotomy is when your doctor makes an incision in the posterior vaginal wall, your perineum, to enlarge the vaginal opening to quickly get baby out. Not all doctors practice this, but it's a great question to ask what their percentage is of performing episiotomies. Question 5. What will you do to reduce my chances of tearing? Some doctors practice perineal massage, some do warm compresses, and some don't at all. I've seen it. So it's important to ask that question. Question 6. What positions will you allow me to push in? You know, some doctors only allow you to push, on your back with your feet in the stirrups. And other doctors, are okay with you pushing on your side. Or if you don't have an epidural, pushing on your hands and knees or pushing with a squat bar. So there are definitely more options, so it's great to ask that. Question 7. Do you allow your patients to do intermittent monitoring? I think a lot of people think that you have to have continuous monitors when you're in labor, and you really don't. As long as baby's doing well and you're doing well, you can have intermittent monitoring. So that allows you the freedom to get up and move around and not have those monitors on you. So it's great to ask if that's available and if your doctor is comfortable with that. Question 8. Will you allow me to get in the water/tub if I wanted to? Again, if you don't have an epidural, I think the water is the natural epidural, so it's so great to use, especially when you're in transition. So some doctors don't feel comfortable with you getting in the water, and some doctors do. Some hospitals don't have it available, and some do. So it's great to ask that question as well. Question 9. What is your induction rate, and how far will you let me go past my due date before I need to be induced? Some doctors usually only allow you to get to 41 weeks and some allow you to get to 42. So it's important to ask that question because 20% of births are done via induction. And also, I tell my clients, if this is your first baby and you're going to be induced, you're doubling your chances of having a cesarean section. So you really want to try and avoid having an induction. And question 10, where do you deliver? Some hospitals have, better reputations than others. So you want to ask what hospitals your doctor has privileges at. So then that way you can pick the hospital that you prefer to have your baby in. So these are my top 10 questions that you should be asking your OB when you find out that you're pregnant. I'm going to be posting these questions here on our blog, as well as some additional questions that you can ask. That way you can print out this list and bring it to your next doctor's appointment. I hope you enjoyed the video, and we look forward to seeing you again soon. Have a chic week.